It says live, so.
I confirm we've gone live, Chair.
Thank you. Welcome to this meeting of Health and Care Overview and the Scrutiny Panel's review of mental health. This evening, we will be looking at the 2021 end-of-year forecast for the mental health and out-of-hours budget. Can I ask for apologies? Do we have any apologies?
We've received apologies from Councillor Mrs Mackenzie, Councillor Temperton and Councillor Mrs Mattick.
Thank you very much indeed. Do we have any declarations of interest? Nobody's interested, that's fine. I can't see anybody making any representation. I would like to welcome the following people to the meeting. Councillor Dale Birch, who is the Executive Member of Adult Services, Health and Housing, Gráinne Siggins, Executive Director for People, and Tony Dyer, Assistant Director, Mental Health and Out of Hours. So thank you very much for coming on to this. Would you like to tell us about the end of year forecast?
Yep, perhaps if I can launch. I'll be handing over to Gráinne and to Tony Dwyer in a minute to go into the detail, but within the scope of your inquiry, Chairman, we have prepared the details for that which we have the information. And I know you'll be talking to other partners in due course or as part of the process, and you can get more information from them in particular. The key elements of what we're going to talk to you about is specific to the council and the services that we run. And I understand where some of the questioning might come from, because we are one of the earliest authorities that pooled budgets with our health partners to work together in the area of mental health, particularly adult mental health, and you'll learn a bit more about that from Tony. So in actual fact, given the questions that you've asked, by the end of Gráinne and Tony's presentations, you should have received sufficient information for you to answer those. And I'll be happy to come back in where any gaps may appear to support any questioning or lines of inquiry after you've got the detail. So if I can ask Gráinne to come in, because I don't want to do a bit and then have Gráinne repeating. So thank you.
Thank you, Councillor Birch. Thank you, Councillor Gibson and colleagues. And firstly, thank you for undertaking this Scrutiny Commission on mental health services. Supporting people, adults and older people with mental health issues is something that we are committed to continue to do, and an area, glad to see it's an area of specific interest and focus, especially with the post-COVID period and demand increasing, and our need to support people with low, medium and moderate and complex levels of need. What I'm going to do, so the question was primarily in relation to the budget and how we're spending our money, the money that is funded through the local authority, so Bracknell Forest Council. So what I'm going to do is to bring up a couple of slides, and I'll talk through both lots of slides with the input from Tony operationally. Now, I'm not as fluent as utilising Zoom as I am Teams, so bear with me if there is any delay. So can you see that on the screen?
Yes, I can.
Okay, so what was indicated and as part of the question was the fact that we've got an overspend position on this area of service, and where these services are unique in terms of how we prepare and then monitor the budget relates to assistant directors' portfolio of teams and areas that they oversee. So to ensure that we were being comprehensive, and it went back to the original figure that you inquired about, we've actually put up the whole budget. But not all of the budget in Tony's area relates to mental health or older people mental health. But we felt it was helpful, just so that the numbers balance back to the original query, that we would answer that query and just explain, but we won't go into detail on some of the areas that were indicated, albeit others were. And I will translate the spend, because again, we wanted it to link back to the original query. So we've got a bit of narrative on the right-hand side, but the left-hand table I will talk through. So firstly, in relation to the original question, was about total amount of budget that is spent on mental health services across the system. We don't have that information. There's a range of people where there is a level of budget committed, the largest one being our clinical commissioning group, who commissions a significant amount of services directly, and then as part of our integrated team delivery and to meet a range of duties within which the council is responsible for, this is the budget that we contribute to that whole in terms of the spend. So we can only show you the information that we've got here. What we are going to do is to provide the information for a 3-year period in relation to this budget specifically for the council. So you will have that follow after the meeting. So if I can just describe what we mean by purchase care. So a little bit later, you'll be hearing about the number of people that we support. So there is a significant focus on both adults with mental health issues and older adults with mental health issues. And those teams are both integrated with health, and we work collectively and collaboratively together to try to make sure that between health and ourselves and other partners, that we're meeting the holistic needs of individuals that we're supporting. So we do support a significant number of people who we don't therefore commission care for or buy care for, but those people are still supported through the community mental health teams, through professional support. So a little bit later, Tony will talk through a larger group of individuals, but those individuals who we support where their needs are that significant that we have to purchase care for them, those are the ones that are showing in the budget, but it is only a proportion. So we do a lot of prevention and early intervention work with individuals, giving advice, support with our health colleagues to support people to manage their issues and to support carers and families too. But when someone's needs are so high that they need us to purchase care to meet a need that is specific to the assessments that we've undertaken, we do then purchase the care and support. The multi-agency teams continue to work with those individuals. And so we continue to support them again, collectively and collaboratively, as what we call a multidisciplinary team, which means a range of professionals are involved in trying to support those individuals irrespective of the level of need once they're in the service. So these figures here at the top relate to those whose needs are so high that we need to purchase care to meet the needs, and they can't be met through professional support and lower level interventions and advice alone. So purchase care is how it's described, and there's a total overspend, as you can see there, of almost £400,000, so 399,000, and that is so we'll just talk through the headline of the budget first. So for the community mental health team, that's the adult team, our budget is 1.398,000, so 1.398 million is what we spend on care, and we've got a number of individuals who we are supporting, and those numbers go up and down during the year. So every month those figures might be slightly higher or slightly lower, depending on the nature of the care that those individuals are receiving and where they're at on their recovery journey. Part of that. So we monitor those figures closely on a management level weekly, and then we see those figures once a month. So the community mental health team is currently showing an overspend of 277,000. Of that one alone, and there's been a level of analysis undertaken so that we can understand what does this mean in terms of where we're spending our money. And I'll go through, there's a summary there to talk about you know, what that looks like in terms of numbers, but the unit cost, how much we pay per person and what we're paying for providers, has an impact on those figures. And we'll go through a number of charts on the second slide that will go into that in a bit more detail. So that shows where the cost of care currently is 277,000 higher the amount of money that we've got in the budget to pay for that care at this present moment in time. And that's what we're forecasting as an overspend. For community mental health older adults, a lot of those individuals are people with very complex dementia and are supported as people get worse and they're living for longer. The cost of care for those individuals in terms of level of need we have to meet to support them, either to remain at home or if they need to go into residential and nursing homes, the level of support they then need in those units to actually support them to get the best outcomes that they can. And so we're assured that people are safe and that quality of services are high. And we can tell you a little bit about what that's meant over the last couple of years in terms of the cost and how the cost of that has increased over time, and what the numbers are looking like. And again, we'll go into a number of different slides on the next number of different tables on the next slide, just to go through that in a little bit more detail so you can understand that. But from an older people perspective, at the moment, we're forecast 122,000 overspend, but we do spend an awful lot of money to try and support people with complex needs, older adults with complex needs, to remain safe in the environment that's appropriate for their care. Wherever possible, we try to support people living at home for as long as they can, and that is reflected in the support that we provide. So this is a very volatile budget, but again, with the charts that we'll show you in a short while, you'll be able to see how those numbers have gone up and down over time, and what that means in reality in terms of how we're managing that budget. Both of these budgets are very volatile and will depend on who's coming into the service, how far we've been able to move people, generally adults, on their recovery journey, and who's actually in the service and how long they're supported for in that service. So that is the first two in terms of purchase care. There's actually, let me just go to the next slide, because I think it might be helpful if I bring up the next slide, if I can move quickly through this. Have you got the next slide now on screen?
Yes.
Yes.
Okay, so it's not letting me, oh, it is letting me enlarge. So has that gone bigger on your screens?
Yes.
Yeah, so what we've attempted to do is show the number of people being supported over a period of time. And we've gone back to the time period that you've asked us to reflect on in terms of the overarching table and what it shows. And in short, for the adult community mental health team, so these are adults, not older adults, we have had an increase in client numbers of 23% and a cost increase of 66%. And that's what the table is showing you. It's not a straight line graph, excuse me. So as you can see there on the table, in April 18, we had about, I think that's 47 individuals being supported. We had some people going in and out, but primarily an increase in numbers. Increase in numbers sort of stabilised during 2019, slight increase, but then we had a significant increase going into February and March there. So we can see December, January, February increase starting, and then we had a significant spike around March, April, then started to come down. And then it's gone up. Now this is this year. So we've had a higher peak of people being supported with a purchase care to support them in having their needs met. So the highest peak of 65 was in April this year. So you can see there we're supporting 65 individuals at that point. Then the numbers come down slightly, gone up a little bit, and then come down again. So I haven't got the exact figure, but that looks as if it's 58. I think it's on the other sheet. So 58 individuals. But what you can see is number of people being supported with paid for care directly was 65. That was its highest amount in that period for April this year. So obviously we would have set the budget at some point, taken into situation into consideration a variety of different factors, and that would have been about this same period last year, and then it's slightly refreshed as we finalise the budget setting process in the year in terms of numbers of people being supported. So that is the adult team. I'll quickly move across with tables so that you can see the increase in cost. So the cost per week, as we can see, going back to April 18, the cost there is just below 20,000 as the weekly net cost of care. Went down slightly. We're talking at April and pointing to the April 18, but you can't see me pointing on the screen. And then when you look at the highest amount that it went to, so total weekly cost went as high as, that's about £34,000 per week. So when you're actually looking at the position, it went down again, went up again, went down. So variable in terms of numbers. Then when you look at where we're at to now, there's been a increased cost per week of £12,900 per week compared to the same period in 2018. So that figure there. So you can see there how the cost has increased at a significantly higher rate than the numbers in service. Numbers in receipt of costed care that we purchase to meet need, has significantly increased compared to the numbers of people in the service. And that's happened for a variety of different factors, both in terms of the complexity of individuals who are in receipt of services and what they're, in order to continue to support them, their needs may have increased, and also in relation to the cost of care. So the cost of care for some providers has significantly increased over that period of time. And this then shows the average weekly cost, this last graph, for community mental health adults. So in April, it was about, say, £410 per week in April 18. And our average unit cost now is weekly cost per individual. So the unit cost is £550 per week. This is average over all of the levels of need that we have. So it's only useful in terms of getting the headline position in terms of what does that look like over time. But that will show the significant increase. But I think this one is more stark, where it shows the total amount we're spending per week on the total cost of care for the adults who are in receipt of community mental health service compared to April 2018. And those figures have increased from a cost perspective much more significantly than the numbers of people in receipt of service. Do you want me to go on to older adults now? And then I can always come back to these graphs. So do the summary position first. So this is about purchase care again. So I've gone on to older adults now, number of clients.
If you wouldn't mind.
Yeah, so this is older adults. So it's people within the older adults team. And the primary need for these individuals is people with dementia. Now, we do try to support people for as long as possible in the place closest to their home as possible. But it gets to a point where somebody's needs are so complex that often the type of professional support and other means they do have to go into complex nursing care. And that happens over a period of time. Now, as Tony pointed out earlier to me, a lot of these individuals are living longer, so their lives are living longer, but they have a longer period of ill health and managing dementia. So this graph, I try to think carefully and sensitively how I describe this, because it's people's lives that we're talking about. So in April 2018, we'll see there numbers of individual being supported at that snapshot at that point was about 208. We've currently got 230 individuals as of the end of October being supported. So that may not be a significant increase, but compared to where we're at before, it is an increase over time. Let me talk to you about, just describe the graph. So what you'll see a variation of numbers where some individuals sadly pass away. The opportunities for significant recovery, somebody with complex dementia, as you know, is quite limited. So where we have got a significant reduction, often that is down to individuals sadly passing away. So we've then going up over a period of time, slight increase to just below 220, sort of for the December 19, then we have a drop, April 19, then sort of plateaus, and then we have a significant peak. If you can see there, sort of February, March, that peak there, February, March 20, we all know what was happening at that point, national lockdown, and we had a significant increase in numbers of people to almost 240 people supported during that point. Then unfortunately, we had from about 239, we had then a drop by June to, sorry, let me just get that one back up. A drop by June, just looking at the graph, a drop by June to about 211 people. So we had a drop there from 239 to 211 over a 3-month period. 239 to 211. So sadly, we had a significant number of people who died or come out of service for another reason, but the primary reason, it might have been people in receipt of 100% continuing health care, where care took on their package, but the majority of those individuals would have sadly passed away during that period. So I haven't got that more detailed breakdown as to how many of those converted over to 100% health funding, because they wouldn't then appear on this sheet. And how many of those individuals might have gone into hospital and then might have died. So the destinations of those 239 at February, March, we have got more detailed records behind the scenes and we can identify that, but that wasn't the question asked. But this is just to show you how the numbers vary over time. So during that COVID year, we had a number of people who stopped receiving a service. Then they went up slightly for August, plateaued. Then we had another significant drop again, December, February 2021. Sorry, it's December to Jan. So you can see then we've gone to an all-time low in numbers. Then it's gone up again significantly in numbers between 1 month. And then we've had another peak from June this year up until June, July, to again, not quite the peak that we had in the previous year, February, March, but it's gone to a peak and then it's come down slightly at the end of this period to 230 individuals. So you can see how that goes up and down over time. And this will give a snapshot of numbers in service at the end of each month in terms of these numbers of people that we're supporting with complex needs. So that's that graph. Sorry, I'm struggling to speak at the moment, but that's what that graph is saying. And the next table indicates, like the other one above it, is that weekly costs that we pay and towards supporting people within these. But in terms of the client numbers overall, increased by 11%, overarching numbers, but the costs have increased by 25%, in short, in terms of the weekly cost of people being supported over that period of time. So the costs, again, have increased significantly compared to the numbers, but nothing like the cost increase in the mental health adults. So mental health adults over that period of time, the weekly cost has been significantly higher than those for people in the older adults team. But again, there is a significant increase over that 3-year period, as indicated by that graph. And again, that last one is just the net unit cost per week. And that goes up and down, but not to the same extent. But what we can say is in April 18, unit costs, so on average, the amount of money we're spending on average per person per week was just under about 498 probably there. And the cost of care unit cost is 550. So that's increased over time as well, as described by that graph. So we've had an increase in numbers. In mental health is 23%, but the unit costs have gone up significantly, 66% over that period of time. And the numbers for older adults has increased by 11% between the two figures. We've had a lot of variance during that time for the details and the reasons I've articulated, but we have had an increase in unit cost. So what the cost of care is meaning in terms of the budget, and that will be based on both the elements of need, both complexity, but also the cost of the provision that we have to pay to support people in the community to meet their levels of need. So let me go back to the previous slide. So that's in relation, have I gone back to the first slide?
Yes.
Yes.
Yeah, okay, so those are the headlines, and we can come back to those slides to go into a bit more detail in a short while. But that's the first 2 lines of there, which was a significant portion of what we wanted to articulate, because it is the majority of the budget that we've got and that we spend. for mental health, both adults and older people. And as you can see, significantly higher proportion of our mental health budget is spent on older adults. And that's the budget where we use to purchase care to meet those individuals' levels of need. But as I say, it is delivered with an integrated environment with our health colleagues and those health professionals' input into the care and support and the assessments as required. But it's exceptionally vital when we're talking about those people with lower levels of need who are supported with professional support, where the professionals work together to support those individuals to live the lives that hopefully they can live and manage their mental health issues and prevent them becoming more poorly. Again, just going back to the question asked about the overspend, these then directly provided budgets. Tony, do you want to talk through these? Because of me struggling to talk at the moment, do you want to go, and then I'll take over care management.
Of course, that's fine.
Just to say that we have gone through the first 25 minutes, half an hour. I would like to bring the questions. I know that there might not be any, but you've probably got about another 20 minutes.
Okay. So the next few are very, very quick, and then we'll say a little bit more about the care management, which is staffing. So Tony, if you quickly go through those, because they're just about the nature of how they appear in the budget and what those figures mean for mental health budget.
Yeah, so directly provided services. So again, this goes back to what Grania said at the beginning. The budget that you're asking about is specifically mental health, but as my portfolio, it also has the community network, Glenfield, drug and alcohol services, and the emergency duty service. So you can see the different budget lines that sit against each of those. I guess the most important one in there is the CMHT, the CMHTOA care management. You can see that's just over 1.6 million, and you can see the forecast is a potential overspend of 84,000. The mental health and grants, I think that's income, so we don't really need to talk about that one. But I suppose the bigger one in there is the mental health vacancy factor. So you can see there that there's £178,000 expected savings through vacancy factors against the mental health budget. And you can see that's currently also over by 89,000. So when you put the two of those together, that creates, 123,000, I think it was when I last
173.
Sorry, 173,000. Yeah, so that is the overarching budget. You can see primarily, other than the stuff that Grania's described in terms of the purchase, the other pressure is around staffing. And if you want, Grania, I can just quickly go back to where you talked about those slides around the CMHT and the support, just so people have got clarity. So where you're looking at costed packages, could you go back onto the other slide? Thanks, Grania. Where you're looking at costed packages for adults, that you've got a total there of, 58 people. Actually, the CMHT for adults supports almost 400 individuals. Actually, it's only those 59 people that have got costed intervention. The rest of it is professional support that's provided by the multidisciplinary team of nurses, doctors, social workers, physios, etc. So that's just to give you the scale of the amount of, because I don't want you to think that there's only 59 people in Bracknell that require secondary mental health. There's actually over 400 people being worked with and supported in adults. So actually, as a proportion, we keep the required intervention of purchase care pretty low because of the level of professional support that's required. And then for the older adults, on a similar note, again, it shows there around 230 people with purchased care support, but actually the team support around 420 individuals. So again, a lot of those are receiving other forms of support. They might be discharge to assess, they might be self-funders, but their avoidance of requiring packages of care at this moment in time. And the other element that supports that is we do have the Dementia Advisor Service that has over 250 people that they're currently supporting that has those packages of care badged against it. And I think just adding on to that, Grania, because I know that we want to get through the questions, I think just the other examples around the cost of care. So I think residential and nursing placements, back in 1819, you could buy a bed for around £880 a week. Currently, we're paying £980 a week. So there's a significant increase in that cost. And then for older adults, for memory and cognition, we were paying around £880 per bed. We're now paying £980 per bed. So again, so they're both probably about an increase of about 8%, and that's just a part of the care packages that are purchased. Obviously, there's domiciliary care and other services that are purchased that have also had a change of cost over time. Anything else, Gron, you want me to cover?
No, I'll stop sharing the screen now to allow us to then answer the more specific questions. I haven't got the questions up on my screen. So what we're trying to do with those tables was to show how the budget is broken down, how it's broken down between adults with mental health issues and older adults with mental health issues. The areas we didn't talk about at length are the other parts of Tony's budget that don't relate to the mental health service. So the primary spend in mental health is around the care that we provide and then the staffing. In terms of the numbers of staffing, just the last thing I just want to share is that it has been very difficult to retain social workers across the whole of the South East. It's not something that's specific to Bracknell. So we're doing all that we can to attract and recruit permanent staff, but it has been difficult for a number of years now to recruit permanent social workers. And it's very, very difficult also to even recruit agency staff. So in terms of that support, we're doing this.
I have a question here, Gronya, if you don't mind me interrupting you. Yeah. I am conscious that we've got about 20 minutes left. Okay. Just to pick up on your last point, though, recruitment and retention has always been a thorn in the side of social services. I know that from past experience. And with the additional impact of organisers like Amazon, we're actually having a smaller pie to recruit from and compete with other people that provide care. So it is a very difficult situation at the moment. It's one of the things that triggered my question from the original budget, though, was because we were told that it wasn't staff costs, it was due to the impact of COVID, which now that you've explained it, you can see how that's arrived at, and there's still an impact on Tony's budget because of that. But thank you for that explanation. Michael, can you would you like to ask a question?
Yes, I will. Thank you very much for that, Mike. In fact, following on really from the question that you asked, I think part of the problem may well be, and this is observation, that some of I suspect we probably have to employ a number of agency staff rather than permanent staff. And obviously that has a cost implication for us. What I was going to ask actually is with regard to forest care and the overspend, is that the final figure, or is there more to come in terms of the transformation or the transfer from the transport depot? And also, I got the impression, I'm sure that Stuart McKellar had indicated there was an amount of money that had been provided to allow for the transfer from the transport depot to the new facility in Waterside. Has that been taken into account, or was it absorbed in the figures?
Sorry, could I just, before Tony comes in, Forest, could I just draw that? Forest care is within Tony's portfolio area of responsibility, but is not to do with mental health per se. So that any movements between that to Waterside, etc., whatever, is not directly attributable to the mental health questions that we've got in the questions from yourselves.
Dale, yeah, in that case, then maybe I withdraw the question. The second question is there government funding being provided for mental health, in terms of supporting our organisations? Is there any evidence that we can actually see of the support that we're receiving?
Just the general settlement to the council. There is no additional bespoke support for mental health to the council.
Right. Thank you, Gronya.
So all the councils are in the same boat on that one.
Amen.
Michael, is that second hand come up?
No,
I don't think so. I think it's the first hand.
About to come down. Let me do the necessary.
Can I just ask the other panelists whether they've got any questions on the presentation so far? I'm not seeing any
Well,
movement.
my question then back to the panelists and yourself, Chairman, do you feel that we have answered the questions that you set us in your email to us? Do you want to just do a quick check to make sure that you've got your questions answered?
Yeah, I mean, one of the important things about this scrutiny role is the transparency of what we're doing. And because something came up, I had no doubt that there was explanations, but we are focusing on primary care from our partnerships. And we needed to have this meeting so that we could, and I'm very grateful for the time of our senior officers and yourself to come along and actually make sure that not only us, but wider councillors have actually seen why we raised it and the answers to that question.
Yep.
I'm going to ask Jen, who's got the questions in front of her. Is there anything on there that we need to, that we would like a response to, or we need a further response to? I'm just trying to check my list of questions on that as well, but I'm happy so far. Jen?
Nothing that I would particularly pull out, but obviously it's the panel's questions and the panel's opportunity. So I will.
I've now got them in front of me. Panel's going to read first primary care volunteer sector.
Grania is probably going to try and assist.
Right, Grania, please.
Now I've got them up. It was just to say the question 5 in relation to COVID. Hopefully, having described that journey of the number of people in service, you will then see the impact that the COVID potentially has had, without me saying the obvious words, on the budget. So during the infection rates, and you can actually see the numbers of people being supported during that COVID year and what that looks like now. So hopefully question 5 is answered through the graphs and the description provided. And the mitigations, hopefully as well, the amount of detailed work of professional support that we undertake to support people with some really complex mental health issues without paying for costed care, because supporting people to help them manage their own mental health as far as possible, giving them advice, support and interventions is undertaken. So those mitigations in terms of the forecast pressure is just significant to note, and it helps with quality of life and outcomes. But on the older adults as well, wherever possible, where we feel that individuals have met the threshold to need continuing health care, where health will take over the package of care or at least part fund it, we do everything we can to make sure that we're sharing the burden of the cost and easing the burden on an individual as well, so they don't have to pay 100% continuing health care costs.
I think we're clear on sort of the secondary care and how people have tipped into that and how that can be more expensive and how the panel itself is quite trying to be focused, as Dale referred to earlier, on primary care and voluntary sector. And I think in question 6 we've said, have there been any changes in primary care or voluntary sector mental health services which have added to the council pressures onto the council? And I think I'd just like to explore that a little bit, but I don't know if that's Tony or you, Grania.
Well, no changes that we're aware of, other than some of the change in terms of how people access services during COVID. And that's not just relevant to mental health services, it's relevant to other services too. So primary care access may have been an issue. We've been able to respond collectively and collaboratively as a group of professionals to ensure we're still meeting people's support, so that hopefully, whilst the offer may have changed, the levels of support shouldn't have changed.
Absolutely. Tony, did you want to comment on that?
Agree with exactly what Grania's just said. And I think, if anything, when you talk to your colleagues in the CCG to explore things further, they'll probably describe a couple of additional services that they've been funded through Central England NHS to try and help at a lower tier. So, you know, where you've got talking therapies, they've now got some linked workers into GP surgeries and stuff, but that's purely health driven and would be best described by our colleagues. We have had
conversations with them. As I said, it was just on what pressures that's put us under, rather than, because we've had that conversation with health already. Dale, is there anything you want to? Oh, Grania's got a hand up again.
Oh no, it's an old hand.
That's the old one. That was still there.
Dale, is there anything you want to sum up? I'm conscious that we've mainly been interrogating Grania and Tony with this.
No, I'm relieved, aren't I? I'm hugely relieved.
No, for a word, Dale.
No, the important thing that you've asked us to do is explain the reasons why we have an overspend situation in a couple of areas of our budget, and to seek to see if it is COVID related. I think the answer is there is an element of COVID, because there would be, but predominantly it has been a growing theme in the care market, for want of a better term, that has shown that as people are living longer, their conditions that they first come to our attention with deteriorate, get more complex, and also the actual bed costs, once you're into that level of care, have gone up quite significantly. And so it's the state of the market and the added emphasis of COVID that have added to our predicament. And of course, and you mentioned in the word forecast, there's only so much we can assess as in our budgets as a forecast for increases and so on. And some of those external pressures in the market, particularly if you've got another partner in the market able to pay those additional costs because they've got more money than us, then you will have that continued need for a more level playing field in the care market.
I'm going to interrupt you just there, Dale.
Carry on. I'm done.
Partly because I think looking at the market is something that we might need to do as an overview and scrutiny. Indeed, we have on our last panel discussing future reviews that we will look at that market. I mentioned earlier that we all know that there's things like Amazon where you can get paid more than doing the care work, and that's having an impact. And I presume you'd be happy to assist and provide officer resource when we look at that as a possible review. Thank you, Gronny.
I simply couldn't comment. We're already in an overspend situation, Chairman.
Can I ask Nick? He had something to add. Nick?
I just wondered whether there are any lessons we can learn from the fact that we have essentially under budgeted. I'm guessing we weren't caught by surprise potentially on this, but we have underestimated the level in the budget and being bought out. Is there any lessons we can learn to try and avoid this happening next year and going forwards?
Before Grania comes in on that, of course, it would be very easy to say, oh yeah, we'll just bung X more % on in terms of, and we think it might be that. And then we have the other side of this very finely balanced argument. We're then hauled over the coals for not spending enough, etc. So it becomes that very fine balance between trying to make sure that we don't over budget and then and underspend, etc., because that can be seen as much of a crime as to under budget and overspend. Grania.
Yeah, thank you. I mean, it's a fair question, but with demand-led services, for the last 30 years since I've been involved in social care, demand-led services are always difficult to forecast. And during the COVID period, not knowing the number of people who are going to accelerate into psychotic breakdown with what was happening in the environment was difficult. So during that period, being able to predict people who are going to go into acute mental health status and require really high levels of intervention was difficult. We do use trend data. Trend data really has been shot out the water with COVID, as you will know. So I think a different question is understanding the health inequalities and the impact of COVID on the health of our population, and what do we think that's meant for the future demand for social care is a bigger question that we all need to understand. So how useful is our trend data in the context of the impact of COVID? So it is difficult. Yeah.
I'm going to say, and you also have to remember that we don't think COVID's going away. So,
you'll recall recently, Nick, I did a couple of media things about alcohol and drug use during lockdown and the pandemic, and these things have an effect on people's mental health and psychosis and so on and so forth. So I'm absolutely certain we are going to see, even if they declare COVID gone at Christmas, if they were to do that, we are still going to see a taper after when COVID isn't such an impact. We're still going to see some of those effects, but we are better armed now, and I would anticipate for that sort of demand, I think we are likely to be able to better predict because of the lessons we've learned during the pandemic.
Okay, thank you.
Thank you for asking that question, Nick. Much appreciated. I hear what you're saying, Dale. Looking at the graph, if you take it from the 18th pre-COVID, that's still a pretty straight line with the variations from COVID coming in, but there's still a generated increase. I could, sort of rephrase the question of why haven't you got a decent crystal ball? We learn what we can learn from the situation, but I think those graphs were very useful.
One arriving apparently on the 25th of December.
I shouldn't laugh, but yeah, it's that's very useful in the explanation. We will use that, but I think the question that Nick asked really did need to be to clarify for the report that we can actually say that we've got there. So I thank Nick for that, because it's for people to actually see. Grania, any last words before we?
Yeah, I mean, if you look at the older people mental health, so the CMHT OA care purchasing, the variance on that budget is only 2%. Okay. So where we know the numbers of people with dementia roughly, increasing costs per unit cost, but based on our spend generally, that's only a 2% variance, which is really, really good for a demand-led budget. But the adult mental health is a little bit of an outlier, as we'd indicated, but knowing the impact of COVID, on people's mental health and the forecast of those going into acute crisis, is significant. It brings us back to Tony's point in terms of the numbers of people who have been supported with significant mental health issues, so they're under a psychiatrist, who have been supported without costed care by a range of professionals. At any point, any of those individuals could go into crisis. So I suppose the question is about how are we supporting our population within Bracknell to manage their mental health issues, even when it's acute mental health and when they're in crisis, and what that model looks like. So it's a fair comment. And I will, just before I finish, is the impact of COVID on the broader health of our populations and what that's meant for the families as well in Bracknell Forest is probably worth scrutiny, just reflecting on, because domestic violence has increased. What's happened with families who've lost their jobs, things of that sort. So the impact of COVID in terms of broader impact on health inequalities and people living their lives in Bracknell will also be felt.
I mean, we've seen that from some of the things that we've looked at in our earlier conversations with the health partners. Primarily, access has been fought by older population. We've seen a big increase in younger people, 20s and their 30s. For different reasons. So it's had an impact, and it's seeing how that's turned out. It's partly what this review is about. Are there any other comments before we call this to a load? We've got about 3 minutes, but I'm happy to finish there if nobody's got anything additional to ask. I can't see any hands. So
Mike, just one point, Michael Brossard. I presume Jen will give us the slides. Will send the slides to us because there's an awful lot of data. Or is it confidential?
It's been on public. This is a public meeting, Michael. So that's all for the general public. But
I do have the slides, and I will share them
to the other members of the panel, and I'm sure Jen will do that.
And
members
Chair, sorry, I'm just risk of not forgetting to put my hand down. So if people want a little bit of commentary on the second sheet, which is the graphs, we can provide those. There is a brief summary underneath the two sections, but if you want us to explain some of those numbers in the way that I did, especially people in receipt of services and what those significant drops meant, etc. But hopefully I covered it off sufficiently in the meeting. But if you need those numbers explained in any more detail, then do get back to us.
We will do. We will do. If that's everybody's comments, I'd just like to thank our cabinet member and our senior members of staff coming along and presenting to us. I think that was very helpful indeed. And I look forward to seeing you at screen.